Good morning. Governor Newsom, Attorney General Bonta, Mayor Breed, and hospital leadership and members of the San Francisco General Hospital community and San Francisco at large. I want to first of all thank the governor for coming out today to San Francisco General. Many of you know he led the effort to get this hospital here approved by leading the way for Prop A, which funded this hospital a number of years ago. And I want to thank him publicly for that, for support and all the support he's had for all these years. For those of you who may not know me, and there's very few of you who do not, my name is Dr. Andre Campbell. I'm a trauma surgeon at San Francisco General Hospital. I worked here with the dedicated administrative staff, nurses, doctors, respiratory therapists, support staff, dietary staff, taking care of patients here in the city and county of San Francisco. We stand ready 24/7 to work to save your life. You may not need us now, but any given day you may be a victim of trauma, and we'll be there for you. We're proud of what we do. We're proud of one of the top trauma centers in the United States and one of the first to be certified as a level 1 trauma center. It's an honor today to be asked to speak about this important issue of the revocation of the 30-year ban on assault weapons in California. The ban in many ways saved lives in the state of California due to restriction on these weapons. Let me just say this, and I'm going to say this a couple times. An AR-15 is a weapon of mass destruction. It is used in battlefield to kill the enemy. It is a gun that is used in warfare, and it should not be available or used in the streets of the United States. To equate an assault weapon to pocket knife is totally wrong. There is no comparison. As a healthcare provider on the front lines of trauma care for over 2 decades here, the extent of injuries of one does not equal the other. The assault weapon fires bigger bullets at a faster rate of speed and causes absolute devastation to the human body. It is as if a bomb went off in the tissues of the patients, traveling at 3,251 feet per second. These bullets cause cavitation. That means around the bullet there's a large path of destruction that kills people. In simple terms, that means it creates a big hole in people who are injured. The skin, the muscle, the blood vessels, the nerves, the bone are all destroyed as it wreaks total havoc and total destruction on human tissues. Human anatomy is destroyed by these bullets. Many times several bullets strike people and kill them. Tissues are pulverized, permanently damaging people dying in large numbers. There's no way that a simple pocket knife that you buy at a store can be compared to a weapon of mass destruction. Gun violence should be viewed as a public health crisis in the United States. Last year, 20,000 people were killed in gun-related incidents across the United States. Mass shootings received the most publicity, but major cities like New York, Chicago, Baltimore, Los Angeles, and San Francisco, we have victims who come to this hospital every day. Imagine if the equivalent of 40 wide-body planes crashed each year, killing that many people. We would ground all the planes in the United States and try to figure out what's going on. We do not have this urgency when it comes to gun violence in the United States. We all remember the names of the incidents. You heard some already. The ban in California started after a mass shooting here in Stockton, California, in a school where 5 innocent lives were lost and many were shot. We've had mass shootings treated here at San Francisco General, including 101 California's Head, the YouTube shooting, and many others. You've heard the names Columbine, Sandy Hook, Las Vegas, Miami, last week in San Jose, where 9 souls lost their life, and many others around the country. Our hearts break after each of these mass shootings for the victims and their families, some of them here today with us. One recent paper cited in a national publication there was a 70% decrease in mass shootings after the national assault weapon ban over a period of 10 years that it was in place. I do not know how many lives were saved in California from this 30-year ban, but suffice it to say that more people will die because of this ruling. A mass shooting is defined as an event that results in 4 or more people being shot, and even in the biggest pandemic of 100 years, which the shootings persist, the preferred weapon of the mass shooter is the AR-15 with an extended magazine, and it results in many deaths in a short period of time. Now, the recent mass shootings have used the same kind of assault weapon, and I'll say, obviously, once again, a pocket knife is not an AR-15. Last year, there were over 600 mass shootings in the United States, So far this year, we've had 260, 239 deaths, over 1,000 injuries during the COVID pandemic. This year, there's been 1,600 children who have been shot, 650 have been killed, and many others seriously injured. We've gotten better at caring the victims after they are shot off the last 2 decades. We can save a life, but we can't save them all. Each time when I have to go into a quiet room and tell a victim's family that their loved one is dead, it is heartbreaking. No matter what I say, I know the words will change their lives forever. Mothers, fathers, brothers all cry out in pain as I tell them this information. When I lose patients as a doctor, I lose a bit of myself. But we must change the way this problem is viewed nationally. This ruling, in the minds of healthcare providers who provide for care for these victims, will result in more death and injuries, and we must move together to reduce these incidents, promote gun safety laws that make it harder for this type of military-grade weapon not to be on the street. Many approaches have been discussed, but this is a public health emergency in California and elsewhere. In conclusion, as a trauma surgeon, seeing what has happened here over the last couple of decades, I view gun violence as a major public health crisis for all Americans. Patients are injured in many mass shootings each year, but we have many victims admitted to this trauma center every day that you don't hear about, who are injured, who are maimed, who are hurt, who are killed. The pandemic has not stopped this onslaught of death and destruction in children and adults. This ruling puts more people in danger and does not make us any safer. An AR-15 is not a pocket knife. This is not an AR-15. This is a pocket knife. They are different. This is not a weapon of mass destruction. An AR-15 is. Thank you for your time. And with that, I'll introduce Maddie Scott from the Brady, California State President for the Brady Organization. Maddie?